Namaste सबैजनालाई and welcome back to my channel. I am Dr. Amisha Basnet, a medical doctor specializing in aesthetic medicine. आजको यस भिडियोमा we're going to talk about hair fall को लागि गरिने laboratory test हरुको बारेमा and why do we do it. Let's begin. अहिलेको टाइममा हेयर फल सबैको कन्सर्नको विषय बनेर आएको छ। अब यो विषयलाई एड्रेस गर्दै यसको बारेमा यदि धेरै थाहा पाउनु पर्छ भने we need to find the cause. के हो कारण पत्ता लाग्यो भने मात्र हामीले हेयर फलको सोलुसन पत्ता लगाउन सक्छौं। I have another video that is linked in the description. I will give it in description where I have explained detail मा के कारणले गर्दाखेरि हेयर फल हुन्छ अनि अर्को चाहिँ कसरी हामीले त्यसलाई कम्ब्याट गर्न सक्छौं भनेर हैन। अनि कारण पत्ता लगाउनलाई हाम्रो सबैभन्दा बिगेस्ट वेपन हो ल्याबोरेटरी डायग्नोसिस। ल्याबोरेटरी डायग्नोसिसहरु गर्दा चाहिँ हामीलाई एक्ज्याक्टली पिन पोइन्ट आउट गर्न सकिन्छ कि किन के कारणले गर्दाखेरि भएको छ भनेर हाम्रो अन पेपर थाहा हुन्छ। अनि आज कुरा गरौँ त्यही ल्याबोरेटरी डायग्नोसिसमा के गर्छौं हामी र किन गर्छौं। फर्स्ट ल्याबोरेटरी टेस्ट we do is called CBC. CBC भनेको कम्प्लिट ब्लड काउन्ट भनेर भन्छौं। त्यसमा चाहिँ हामी हेमोग्लोबिन लेभल, आरबीसी लेभल, प्लेटलेट्स लेभलहरु सबै लेभलहरु हेर्न मिल्छ। अब हाम्रो यसमा मेन कन्सर्न भनेको हेमोग्लोबिन लेभल हो। हेमोग्लोबिन लेभल कम हुने बित्तिकै हामीले त्यसलाई एनिमिया सपोज गर्छौं। तर that's not it, is it? यसको एनिमियाको पनि लाइक डिफरेन्ट भेराइटिजहरु हुन्छ हैन। अनि मेनली इफ सीबीसी मा हेमोग्लोबिन कम छ भने पनि हामी गर्छौं तर नर्मली पनि इभन इफ इट इज नट शोइङ anemia, we also do further test that is called vitamin B12, methylcobalamin test and folic acid test. In megaloblastic anemia, you're a type of anemia ho, त्यसमा चाहिँ both deficiency हुन्छ. In pernicious anemia, त्यसमा चाहिँ vitamin B12 deficiency हुन्छ. So in general, anemia causes hair loss, particularly a variety of anemia causes hair loss. If I could explain better, anemia हुने बित्तिकै hair loss हुने possibility high हुन्छ. So we keep eye on that. So for us, if someone is going through hair loss, we try to check if the patient is anemic. Anemic हो भने कुनै vitamin deficiency ले गर्दा भएको anemia हो कि के हो भनेर we need to differentiate because it helps us to provide the patient with the reliable supplements. Okay, so the next one is thyroid function test. यो चाहिँ thyroid भन्ने एउटा हार्मोन हुन्छ हैन। अब यो पनि एकदम कम्प्लेक्स डिजिज मै पर्छ किन भन्दा there are like TSH level, T3 level, T4 levelहरु चेक गरेर we differentiate मान्छेलाई थाइरोइड प्रब्लम छ कि छैन भनेर। अनि यसमा हाइपोथाइरोइडिज्म, हाइपरथाइरोइडिज्म भन्छ हैन। जस्तै कमी हुनु र थाइरोइडको लेभल कमी हुनु, थाइरोइडको लेभल बढी हुनु दुईटै प्रब्लमेटिक हो। अनि दुईटै प्रब्लम एसोसिएटेड विथ हेयर फल छ के। सो इफ यु हैव थाइरोइड प्रब्लम एन्ड तपाईको हेयर फल भइराछ भने चाहिँ दैट कुड बी अ रिजन व्हाई यु आर गेटिङ हेयर फल के। किनकि इभन हाइपरथाइरोइडिज्म, इभन हाइपोथाइरोइडिज्म दुईटै थाइरोइडको इस्युहरुमा हामीले हेयर फलको प्रब्लमहरु देख्छौं। अनि तर मान्छेहरुले थाइरोइडको अब यसमा चाहिँ इफ you come to some physician अनि मेरो हेयर फल भइराछ भनेर आउनु भएको छ भने त्यो प्रब्लम हेयर फल seems like a small problem तर underlying causes हरु एकदम ठुलठुलो हुन सक्छ के। So we make sure that you don't have thyroid problem. त्यही भएर के हामी भन्छौं कि do you have thyroid problem भनेर already if you're diagnosed then we try to check if your thyroid level is in control. हैन if you are not diagnosed we try to find out अहिले thyroid को अवस्था कस्तो छ भनेर यो त्यही भएर thyroid function test or thyroid को टेस्ट गर्न चाहिँ it's important if तपाईलाई तपाईको हेयर लस को कारण पत्ता लगाउनु मन लागेको छ भने चाहिँ त्यो प्रब्लम सल्भ गर्न मन लागेको छ भने चाहिँ हैन। अब अर्को इम्पोर्टेन्ट टेस्ट भनेको हाम्रो हैन न्यूट्रिशनल डेफिसिएन्सी टेस्ट भनेर भन्छ हैन। अब यसमा चाहिँ द वर्ड इटसेल्फ डिस्क्राइब अब वर्डले आफै डिस्क्राइब गरिरहेछ व्हाट डज इट मीन भनेर। यसको अन्डरमा चाहिँ धेरैवटा फ्याक्टरहरु पर्छ के। जस्तै जिंक हैन we need to test zinc because zinc को deficiency ले गर्दाखेरि पनि hair fall हुन्छ we need to check biotin like we need to check if your body has enough level of biotin bhanera we need to check if your body has enough level of iron as well so we do ferritin test and अरु भनेको we do vitamin D test as well यो पनि nutrition मै पर्छ vitamin D को deficiency ले गर्दाखेरि पनि hair loss को possibility एकदम high भएर जान्छ अर्को टेस्ट भनेको चाहिँ हामी lipid profile को टेस्ट गर्छौं why because a lot of the people मैले भनिहाले नै in the next video I've talked about the cause right lifestyle is a major cause for hair loss अनि त्यसले गर्दा कस्तो हुन्छ भने हाम्रो बडीमा डिफरेंट काइन्ड अफ कोलेस्ट्रोल हुन्छ हैन some are good cholesterol some are bad cholesterol हामी भन्छौं नि no this is a good fat and that is a bad fat भनेर भन्छौं नि हैन like for example fish oil is a good fat it contains omega 3 and there are a lot of good fats out there but there are a lot of bad fats out there so what we do lipid profile गर्दा चाहिँ हामीलाई हाम्रो high density lipoprotein अनि low density lipoprotein triglyceride हरुको बारेमा एकदम thoroughly idea हुन्छ if तपाईको cholesterol level is very high I mean to say the bad cholesterol is high we have to give you supplements to make sure that your cholesterol level good and bad ko chai euta balance आओस् भनेर so for us it's important to see a lipid profile for to differentiate how is your cholesterol level so that यो चाहिँ directly indirectly lifestyle dependent कुरा हो but it is something we have to do if we want to know your body status and why you are getting hair fall अर्को चाहिँ a lot of the people have underlying disease like PCOS हैन यो चाहिँ अब at the same time a hair doctor would not diagnose it but at the same time we would want to know about it right so the menstrual problems छ patient लाई पहिले हामी history लिँदाखेरि if she talks about she has menstrual problem if she gives a diagnosis of PCOS like the diagnosis of PCOS include अब मैले यतिकै भनेर I will not diagnose it there is so detailed about PCOS हैन PCOS पनि lifestyle dependent हो अनि त्यही भएर like female come with hormonal disbalance अनि she talks about having acne hirsutism अनि उसको menstrual cycle abnormal छ weight gain भइरहेछ excessively then that kind of indicate towards PCOS and if she's not diagnosed with one we suggest her to or we refer her to go to gynecologist so that she so that we know that her hormones are at a good level for us to think in other direction like अरु कुरा अरु कारणले हो भनेर सोच्नु भन्दा अगाडि पनि for a woman hormonal imbalance is the big factor so we make sure that that's like something त्यो चाहिँ हामीले याद गरेर बस्नु पर्छ कि hormonले गर्दा हो कि भनेर normally हामीले चाहिँ like if we don't even test those things we make sure that you are already tested के त्यो कुराहरु त्यो symptoms हरु देख्यो भने चाहिँ we refer you to the gynecologist so that you go and test it if you have PCOS or any hormonal issues related so that can also affect and that can be a reason for your hair loss last but not the least test is autoimmune panels भनेर भन्छ यो भनेको चाहिँ के हो भने like I said autoimmune diseases हरु चाहिँ immunity based disease हो हैन त्यस्तै हाम्रो बडीमा भएको immunity हरु जुन चाहिँ अरु disease हरुसँग fight गर्नलाई हामीले बनाएको हुन्छ like हाम्रो बडीले आफै immunity build गर्छ हैन अनि त्यो चाहिँ अरु disease हरुसँग लड्छ सो हाम्रो immunity जति strong हुन्छ हामी त्यति strong हुन्छौं भन्ने एउटा धारणा हुन्छ तर कहिलेकाहीँ हाम्रो बडी ले नै हामी प्रति जोक्स खेल्छ के like for example कहिलेकाहीँ जस्तै हाम्रो कपाल त हाम्रो पार्ट अफ अस हो नि त तर हाम्रो बडीले चाहिँ कस्तो भन्छ भने हैन त्यो त फरेन बडी हो कहाँ त्यो त दुश्मन हो भनेर आफ्नो बडीले आफै हेयरसँग फाइट गर्छ अनि हेयरलाई चाहिँ फरेन बडी भनेर घोषणा गरेर अनि डिस्ट्रक्सन सुरु गर्छ कि हेयर फलिकल्सहरुलाई अनि त्यहाँ अनि बोल्ड प्याचेसहरु देखिन्छ त्यसलाई एलोपेसिया एरिएटा भनेर भन्छ अनि त्यो चाहिँ अटोइम्युन डिजिजसँग लिंक्ड हुन्छ दैट्स बिकज अफ immunity problem के autoimmune problemहरूले गर्दा हुन्छ. And there are a lot of autoimmune problems such as lupus, vitiligo, which also can contribute to hair loss. And for us, it's important to know that your autoimmune system is in balance. So even if we don't do the test for autoimmune panels, we make sure that you refer to people who is expert in this and you are diagnosed with your problems correctly. If it is just alopecia problem it's sometimes visibly नै थाहा हुन्छ के, like dermatologist or even us, we could know it visibly that it's an autoimmune problem. Your baldness is not linked with hereditary but more because of autoimmune, because your pattern of baldness ले पनि अलिकति थाहा हुन्छ it's alopecia areata भनेर. So we don't need to go into elaborate diagnosis for that one, but at the same time immunity matters. Your autoimmune diseases or पनि matter गर्छ. So if you're already diagnosed with autoimmune problem, then we need to keep in mind that that can be the cause for you to have a hair loss. So hair loss भनेको कति सानो टपिक जस्तो सुनिन्छ हैन, एउटा कपाल त झर्नु हो नि भनेर भन्यो, तर your hair loss is just an outcome of the problem that you have underneath के, like तपाईको भित्र भित्र के अरु प्रब्लमहरु भएको हुन्छ त्यसको रिफ्लेक्सन मात्र हुन्छ के. hair loss, skin problems हरु त कहिलेकाहीँ just a reflection of your underlying disease हरु पनि हुन्छ. So it's important for even a hair doctor or a skin doctor to make sure that your blood levels are correct, your thyroids are correct, your lipid profiles are correct, your vitamin levels are correct. यो सबै कुरा चाहिँ त्यही भएर when you go to a hair doctor, they make sure that you are tested with all of these things, so we can exclude we can find out तपाईको के प्रब्लमले गर्दा hair fall भएको छ, and we go to treatment accordingly. So यो भयो के diagnosis, laboratory diagnosis हामीले गर्न मिल्छ भनेर. At the same time, I want to give a little bit of disclaimer. त्यो भन्दामा गएर आफै गएर म डायग्नोस्टिक सेन्टरमा गएर यो सबै टेस्टहरु गराउँछु भन्ने हैन. This is not the purpose for that. It is to educate you. If you go to a hair doctor, certain like blood tests are mandatory, certain tests are mandatory, and किन हामी यो सबै टेस्टहरु गर्छौं भनेर तपाईलाई विस्तारमा बुझाएको, किनकि कन्सल्टेसनमा पनि कस्तो हुन्छ भने like doctor becomes too busy for you to explain this is so elaborate के, किनकि त्यस्तो गर्न थाल्यो भने one consultation would be 1 hour long, right? Because यो भिडियो बनाउन पनि it takes me time, effort and stuff like that. So it takes a lot of time, and I am sure not everybody give you सबै कुरा डिटेलमा बसेर पुरै सम्झाएर त्यस्तो elaborate consultation भएको मैले देखेको छैन. So I feel like this is somehow मलाई लाग्छ कि it will be beneficial for you if you have hair loss and you want to go to consult to your doctor and you have some knowledge, like at least यो videos हेरेर you would know कि ए हैन मलाई यो टेस्ट दिनु भएको छ अनि यो चाहिँ कारण पत्ता लगाउनलाई होला भनेर तपाईको माइन्डसेट एकदम पोजिटिभ होस् अनि किन गरिरहेछ भन्ने कुराको चाहिँ एउटा ब्रीफ नलेज होस् भनेर. अनि त्यही हो, अब थाहा पाएर पहिले पहिले टेस्ट गरेर जानु भयो भने चाहिँ के हुन्छ भने कहिलेका हस्पिटल वुड नट एक्सेप्ट दैट टेस्ट एन्ड फेरि रिपिटेसनमा टेस्ट गराउँछ, सो डबल खर्च हुन्छ. व्हाई वुड यु डु दैट हैन. So yeah, I think that's it. Next video ma chai I'll talk about the treatment. Tyo bhandama right again, I'm not telling you to treat yourself, right? I will just give you alternatives like ke huncha kina dincha. Tapaiko cases haru different huncha, everybody's cases are different, right? Sabaiko causes are different huncha, sabaiko test ko results are different huncha. त्यही भएर it's important to go to your physician, त्यही भएर it's important to go to your doctor, right? But with YouTube knowledge, what I can do is help you educate yourself much better. Like kaha chai kun level ma chai you have to draw a line where you can rely on YouTube and where you have to actually go to the hospital, right? I also work in a hospital right now and I'm working in hair department, but this is not a promotion of that. Promotion hoina, but I will not tell you which hospital this, that and everything. Someday if I feel comfortable, maybe I will, but I just want to give you that sort of education why you should know all of these things. So I hope this video was helpful for you. So I'll try to be as active as possible, and if you have any concern, please you are free to write in a comment in description but down below, and I will make another video addressing that problem. So yeah, thank you. Please like, comment and subscribe to my channel if it was helpful for you. Stay young, stay beautiful. I love you all. Thank you very much.